Okay, so there's a lovely picture of us on our front sheet there. So we are ABUHB and this is our Epilepsy Quality Improvement Team, and we wanted to establish a transition service. Can I have the next slide, please? Thank you. So I'd like to give you some background. So until November 2019, the paediatric patients with epilepsy reaching transition stage were only offered one joint transition handover clinic. The patients and their families had little or no preparation for this transition, and likewise there was little preparation by clinicians or set performer of topics to be discussed. We felt that this service was substandard and we recognised an urgent need to improve our teenagers' transition into adult-orientated healthcare system. So we decided to adopt the Ready Steady Go transition programme, as this provides 3 opportunities to discuss transition with young people who've got long-term health conditions. And this was developed by the Southampton Children's Hospital in 2017. This is a successful, tried and tested tool that helps prepare the young person for the move from children's services to adult services, helping them gain knowledge and skills to manage their own health. So our aim was to send 90% of all our 14 to 16-year-old patients with epilepsy their Ready Steady Go forms by May 2020. So as part of this project, we did a number of tests to facilitate change, so I'd like to tell you a bit more about them. So the first one was to establish how patients and families would like to receive their information about their healthcare. So in December 2019, we did some PASTA voting with our patients and children. We left 3 shoeboxes in 2 different outpatient departments, and we asked them to place a piece of pasta into a shoebox clearly labelled with the option displayed in the pie chart, which was email and text, face-to-face or post. The engagement from the families was really good. We felt that the families were really pleased that we were asking for their opinions and preferences regarding how the service may change in the future. And this uses a patient-centred approach, which is one of the overarching principles of ABUHB. So this indicated a preference for patients and their families to receive the information via email or text at 55%. As a result of this outcome, the children's epilepsy nurses have adapted their documentation to record patients' email addresses for those who wish to use this method. And although this exercise demonstrated what we thought might happen, there remains a significant number of people who want the paperwork sent by post or wish to complete it in person at the clinic. So we need to be in a position to offer all 3. Can I have the next slide, please? Thank you. So the next test was to test the efficacy of completing the questionnaires. This was done with patients and families initially face-to-face, which obviously was then converted to a telephone consult due to the pandemic, via post and email. And we really quickly realised that we needed to create Word documents of the Ready Steady Go leaflets so they could be easily edited on email or text for the digital method to be successful. And furthermore, that we would need some form of feedback from our patients and families to understand the response to service changes. So can I have the feedback slide, please? Lovely, thank you. So we used a simple visual picture scale, and after each nurse-led appointment, the nurse would ask our patients and families to complete the feedback and tell us whether it was the forms were easy or difficult to complete. So 1 being very easy, 5 being very difficult, and how helpful it was to complete that with the nurse. 1 being very helpful and 5 being unhelpful. So can I have the feedback results? Lovely, thank you. So the positives from the feedback results showed that lots of our patients, or the majority in fact, scored 1 for both questions. However, some families very clearly state that they were only able to score so positively because the nurse explained what was required. So the majority of our families felt that they have a much better understanding of the transition process and what to expect in adult services as a result of completing these forms with the nurse. But the negatives were that we had a few less favourable feedback scores from some families where there's significant comorbidities such as learning difficulties or ASD, especially if this was the lead condition and not the epilepsy. So we felt that this highlighted that we didn't know these patients perhaps as well as we should have. And also the other negative was that most families identified that these questionnaires are very lengthy and they do actually take over an hour to complete with each of our families. So can I go back to the test and change slide, please? Thank you. So the next cycle then, which was cycle 3, was to look at the IT. So planning and preparing for IT changes, new clinics and care pathways. So Dr. Anderson, who's the adult neurologist, led with the IT changes, and he created a shared network folder on a secure network for us. At this stage we began to make lots of inquiries about clinic space because we wanted 2 clinic rooms for the joint clinics for transition between adults and the paediatric team, and the children's epilepsy nurses wanted to run weekly nurse-led clinics to discuss the Ready Steady Go paperwork with their patients, so they needed space there. So that was really important. The next phase of this cycle was to actually look at care pathways for mainstream and complex needs patients. So we wanted to ensure that every patient's journey could be replicated. So you'll see with the information details on the slide that our mainstream patients' journey begins a bit earlier than those with complex needs, and that's because they remain within the paediatric remit until 19 years of age. It's also really important to understand that the Ready Steady Go documentation is aimed at mainstream children. So even though there's easy read versions of these forms, they're still not suitable for those patients who've got very complex needs and have got no verbal form of communication. So therefore the children's epilepsy team developed a form that was more sensitive to those patients to ensure that they were not disenfranchised. So can I see the sample of that form, please? Thank you. So this form has already been redrafted 4 times and is a work in progress, and that was as a result of the feedback that we received from our families. Essentially, I've just showed the top of this form to highlight that the families wanted a no box because that isn't identified in the original Ready Steady Go paperwork. For the questions such as does your child have a good understanding of their condition? Well, obviously for the children that have got very complex needs, that isn't applicable at all. And also the families asked for a section to record their feelings and comments separately to the young person, so that actually should be 2 boxes there because that's been revised further since. And we also felt that it was very important for there to be a column for the nurse to comment in to discuss all the topics. We've also reworded some of the phrased standard questions here on the left-hand side. Again, really just to be more sensitive to this cohort of patients. So would be happy to share this with others if need be. So can we move back to the test and change slide, please? Thank you. So, so the next cycle was cycle 4, and that was to develop a transition watch list. So this was the second phase of the IT development. We met as a team and we felt that we needed a more robust way of tracking our patients through their journey of the Ready Steady Go process. So we created a watch list for transition, which is linked to the hospital patient record. So that's a digital hospital patient record on a platform that we refer to as a clinical workstation. And we felt that if this was successful as a system, we could share with other chronic disease transition teams across the health board with very minimal extra work. So once the Ready Steady Go forms are completed, they are uploaded to patients' hospital records on this platform, so they're accessible for all professionals to view. Okay. And then the last section, which was cycle 5, was a final test which we put in May 2020, which was added again due to the pandemic, because we wanted to pilot a video consultation for a joint transition clinic to establish if this would be an option for an alternative to a face-to-face clinic. So can I have the challenges slide, please? Thank you. So the challenges are that we still need to link the delivery of Ready, Steady, Go questionnaires for patients to a doctor-doctor platform. We recognise that for any digital system to succeed, we must ensure that our contact details are correct. So really, we should be using every review or every encounter with the patient to ensure that the details we hold on file are correct. We did encounter some managerial stumbling blocks, which was primarily linked to costings, really, with regards to admin costs for booking patients and detailing outcomes at clinic. And of course, the pandemic. So we really needed to find different ways to support our patients. So we felt that even though when the face-to-face clinics were replaced with telephone clinics, this was very, very positive. And the Attend Anywhere video consultation is also very, very helpful for those patients face-to-face, just on a one-to-one, but it didn't really work that well for our joint transition clinics for the details that are listed on that slide. Okay, so our outcomes. So the transition service is very much a work in progress, but we're really pleased with the progress we've made so far. So we did actually achieve our aim. So we had 98% of all 14 to 16-year-olds with epilepsy received their Ready, Steady, Go questionnaires by May 2020. Hooray! And the watch list is working really well. It's very, very effective and easy to use. So that's another positive. The nurse-led weekly clinics are up and running, and they've been running since March 2020. We did actually manage to locate nurse clinic space in both north and south regions of the ABUHB. Joint transition clinics are up and running, although we did have to cancel our first clinic in April at the onset of COVID. These are two clinics that are run side by side in the same outpatients department. A nurse-led clinic, which is led by the adult epilepsy nurse, and then a consultant-led clinic, which is led by adult neurology with paediatricians in attendance. These clinics are held on a Friday afternoon in an adult outpatients area every 2 months, and the epilepsy nurses are managing the waiting list for this. So can I move on to the last slide? So the next steps are to make sure that we embed the routine collection of transition information into regular clinic practice. And I'd like to introduce the Hello to Adult services documentation at nurse-led clinics within the first year of transition to adults teams. Continue the face-to-face joint clinic transitions, engage with the values team at ABUHB to support the delivery of Ready, Steady, Go questionnaires via doctor-doctor, and ensure that we've got the paper versions of Ready, Steady, Go readily available in clinic for us to use. So the project relied very heavily on the epilepsy nurses to change practice to get this project up and running, and therefore we feel that we need to retain these resources and perhaps improve numbers. And there is some talk about even applying for a new transition nurse-led post. Fingers crossed. So really, for the future, we recognise the need to develop more robust care pathways for teenagers with epilepsy and comorbidity, and this should include access to a wider multidisciplinary team and voluntary organisations. Thank you.